Hello and welcome to Empathy HIT. Your host, Dr. Sandy Whitehouse, is the CEO and CMO of Ticket Health, an award-winning global provider of digital solutions for capturing data directly from and in communicating with vulnerable people within diverse populations. On this podcast, Dr. Whitehouse chats with providers, partners, and industry leaders on topics ranging from digital empathy to social determinants of health, to rethinking how we collect information critical to improving health outcomes.
Welcome to Empathy HIT, where today I am honoured to speak with Vincent Ng, Director of Data and Innovation and of the Specialty Drug Care Program at Bayshore Healthcare. Bayshore's multidisciplinary team of healthcare experts help patients live a healthier, more active, engaged life by offering services ranging from home healthcare to medical support for highly specialised care for chronic and potentially life-debilitating conditions. Vincent is a pharmacist, strategy consultant, and business leader with over 20 years of experience in healthcare. He is the director of the Specialty Drug Care Program, leading a multidisciplinary team of managers, nurses, and reimbursement specialists that help Canadians access and safely take life-changing medications. Vincent also leads the Data and Innovation portfolio at Bayshore. He is responsible for developing and supporting new innovations in business models, clinical delivery models, and leveraging cutting-edge technology to make it easier for doctors to start and for patients to safely take specialty drugs. Outside of work, Vincent coaches his two sons' rep baseball teams. He is an avid reader of non-fiction books and is a CrossFit enthusiast. Welcome, Vincent.
Thank you, Sandy. I'm very pleased to be on the show today.
Your specialty medicine program highlights patient engagement and feedback initiatives and has case managers dedicated to the patient experience. Can you tell us what specialty medicine involves and more about those efforts?
The Specialty Drug Care Program here at Bayshore helps Canadians access and safely take those life-changing medications, as you mentioned. And these medications treat conditions like cancer, multiple sclerosis, autoimmune diseases, and other rare diseases. Now, these specialty drugs are highly effective, but they can be complicated to take and to handle, and they're often very expensive. And by that, I mean, it could be tens of thousands of dollars a year for that. And so what our team does is we have a team of customer care experts and reimbursement specialists and nurses and pharmacists to help patients deal with all the various concerns that they have about taking these specialty drugs. So from navigating the financial coverage to get them reimbursed, to managing their actual condition, to understanding some of the potential side effects of these medications, all the way to arranging for delivery of these medications to their homes or to their clinics. And so that's what my team does at Bayshore.
Thank you. That's important for patients who are also navigating very serious conditions to have that kind of support.
Mm-hmm.
Your patient-centered ethos, built on trust, respect, information sharing, participation and collaboration, is the guiding principle of Bayshore Health. Can you tell us more how this framework guides the specialty medicine program?
Yeah, one of the key tenets of our program is we really try to respect and to treat each person as a whole person. So for example, you're not just a patient on Humira, for example. You're a patient who has arthritis, who happens to be taking Humira. And what that means practically from my team's perspective is that we really try to collaborate with patients to discover and identify what's most important to them so that we can work with them to develop action plans that help address those concerns. So, for example, that patient with rheumatoid arthritis, they may obviously have concerns about how to live life better in terms of managing the symptoms of arthritis, but they may also have questions about how are they going to afford this drug? What are the potential side effects of this medication? And also, they may not just have rheumatoid arthritis to worry about. Maybe they also want to lose weight because they have diabetes, for example. And so our team really tries to work with patients to help them across all those domains. But in order to do that, we have to establish a trusting, long lasting relationship. And that's built on the respect, and it's built on the sharing of information that patients can trust is kept private and confidential. So that's a key building block to help us.
Yeah. So I understand that an important first step to providing care is to understand what each of your patients' unique needs are. How did Bayshore originally capture information from patients?
Not very well, to be honest. So the way we would do it was our initial call with a patient, which we call the welcome call, is conducted between one of our nurses and the patient. And we collected it by going through a series of questions. So we call this the health assessment survey. And through these questions, we can better understand what the patient is going through, what their top of mind questions are and concerns are, so that we can co develop this personalized care plan, as I mentioned. But going through these questions took a good 15, 20 minutes to get through. So that was a problem for us in capturing this information.
Yeah. So what changes in people, processes, and technology did you put in place when you saw the system wasn't working well?
So let me address that question by talking about it from two different perspectives in terms of the challenge. So what I talked about before was from the patient experience perspective. So take 15 minutes to go through the call, and by the time we go through all the other administrative or housekeeping type of topics, we use up the entire 30 minutes, and we would just be touching at the surface of what is of most concern to the patient. So it wasn't a very good patient experience from my perspective. The other challenge was for me managing the program. One of the key things I want to know is, are we actually making a difference in patients' health outcomes at an aggregate level? And in the past, it was very difficult for my managers and I to be able to have the answer to that. And so when we put in the ticket system for capturing this data, what changed in our process was that we were now able to, with patients' consent, be able to send them the health assessment survey ahead of time before their welcome call, so that my nurses could review the responses to see what's important and, frankly, what's not important to the patient ahead of the call, so that they could spend that time in the welcome call more productively. So instead of spending the 15 minutes mechanically going through the survey, they can now have a 15-minute discussion with the patient about diving maybe a little bit deeper into one area of the response and developing action plans. So it was a much better patient experience for the patient.
Can you talk a little bit about the fidelity of the data that you needed and the importance of having accurate data to be able to move forward?
Yeah, certainly. When I think about high fidelity data, the way I interpret that is consistent capture of quote unquote good data at the right time to enable action. And so the technology helped in a few ways. As I mentioned, by capturing some of the data ahead of the call, it helped prepare my nurses to have a better conversation with the patient in terms of the right time. And it also allowed more consistent capture of data. So, for example, we were able to automate the sending out of surveys to be able to capture data over time. We conduct the survey when the patient first enters the program, and then we try to repeat it at various intervals throughout the patient journey so that we can do a before and after comparison to see if they're making progress, if we're making a difference. So that's one way. Another way was being able to have higher survey completion rates, getting more data. As I mentioned, now when we automate it, we don't have to rely on a human being to remember to send out the survey at the right time. And then the second part is when a survey is laid out in a very meaningful and very user friendly way, it really helps survey completion. So we noticed a much higher rate of survey completion through the technology. As I think about more ways that in high fidelity, I think intra-patient consistency in response was really helped. For example, one of the ways that we were able to have patients answer some of the questions were we had those frowning faces and smiley faces to help patients express how they're feeling. And that really helped us understand more accurately and maybe in a more nuanced way how they were doing. So I think those were really the ways that the technology helped.
Yes, do you want to comment on the principles of digital empathy and Bayshore's human-centered design principles? And whether there are any unexpected benefits or efficiencies that you discovered by that alignment.
Sure. What I talked about earlier was we want to develop an ongoing, long lasting relationship, a deeper, trusting relationship with patients, away from a more transactional type of interaction. And having technology actually really helped us to do that, because in the welcome call, it really kickstarted that relationship, because we were able to focus the welcome call on the things that matter to the patient, on their concerns, their conditions, their quote unquote jobs to be done, for example, right? And when we're able to kickstart the relationship by talking about things that are meaningful to them, that really helps us down that path of a ongoing and long-lasting trusting relationship. In terms of unexpected outcomes and efficiencies, one of the things we noticed was greater patient engagement. For me, actually, what was most unexpected was on the staff side, like the staff engagement really increased. And that was surprising to me. And as I dug into it, it made sense because, for example, a large number of the members of my team are nurses, and nurses, they care about people and they want to spend time caring about people. And by using technology to maybe offload some of the mechanics of getting data, they were able to spend more time talking to patients, taking care of them. And this helped them more tangibly see that they're actually making a difference in helping people. And it got them a lot more engaged. And so that was a very unexpected but very pleasant benefit of using the technology for this.
With the stress and burnout of healthcare workers now, having a good work experience or a fulfilling work experience is becoming more and more important. That's a very interesting outcome. Can you tell us what you do now with the richer data that you've captured?
Sure. I can think of three ways that we use the richer data for. So the first way is we're able to tailor patient care better, both on a one-on-one basis, as I talked about the nurses being more prepared for individual consultations, but also from a more program-wide perspective. So what I mean by this is when we have richer data, we can understand, oh, these are the most common concerns that are raised by, let's say, a oncology patient or a patient on an oncology drug. And so the nurse is able to have at her ready resources related to how to make a homemade mouthwash because the patients experience dry mouth. They always talk about dry mouth. So we're able to provide that resource either on the call or as some sort of post-call resource. So we're constantly being able to tailor the care that we provide. The second way is it's helped us customize or tailor our program structure and our team structure. So, for example, there are some very specific financial reimbursement concerns that come up, right, from patients. And so we've been able to develop processes for the nurse to refer the patient over to a reimbursement specialist to deal with that issue when they come up. And we've been able to also align how many reimbursement specialists resources we need, relative to nurses and so forth, so to really meet the needs of our patients. And then the last thing I think I've touched upon it before was demonstrating impact. So I can use this richer data to be able to demonstrate that we're actually making a difference on health outcomes, that patients are satisfied and are happy with the program. And as I've talked about, being able to prove that we make a difference obviously has an impact on the patient, on keeping my team happy, and it has an impact on keeping my current clients happy, but also makes my job of selling the program to prospective clients easier because I can point to tangible, hard data that we actually made a difference.
That's fantastic. As we close out our conversation today, Vincent, what inspirational message would you leave with our listeners as we look at innovation and better data or the intersection of technology and healthcare?
One thing I feel very passionately about is that too often I feel like I hear that there's a false dichotomy of human versus machine, that somehow by relying more on technology or data, we're de emphasizing or dehumanizing the person to person interaction in healthcare. And I actually haven't found this to be the case if you use it properly. In fact, by letting technology and data do what it does best, it frees up the nurses, pharmacists, doctors, and other healthcare professionals to do what they do best. And we know that the best health outcomes are often achieved when patients are proactive and they're engaged and they have productive interactions with healthcare professionals who are prepared. And I strongly believe that technology is a big enabler of patients being proactive and engaged, and a big enabler of healthcare professionals being prepared so that they can have these productive interactions that lead to positive health outcomes.
Well, that is inspirational, and thank you very much for joining us today.
Thank you for joining us today. You can follow the conversation on Empathy HIT on Healthcare Now Radio or at tickethealth.com or at #DigitalEmpathy. And be sure to follow Dr. Whitehouse on Twitter at Sandy Whitehouse.